Hello, my name is Donnie Luper. I'm an endodontist in private practice with offices in New Bern and Greenville, North Carolina. I want to share with you why I have made the switch to the new WaveOne Gold file system from Dentsply Tulsa Dental. I've been using the regular WaveOne file system as my main file system for approximately 3.5 years. I'm very excited about the improvements that have been designed into the new WaveOne Gold files. To understand my excitement, let's review some of the aspects of the original WaveOne file. WaveOne files are designed to be used in a modified reciprocating motor and handpiece. These are not true reciprocating files that just rotate back and forth. They are used in a modified reciprocating motion where the motor continuously changes its rotating direction during the shaping of the canal. Using a large rotating angle in the cutting direction and a smaller angle in the opposite direction provides for relief of stress in the file. This allows the file to successfully progress along the canal path while respecting the canal anatomy. The optimized angles of the file also reduce the risk of a screwing-in effect of the file. This all leads to a decrease in the chance of file breakage. The modified reciprocating motor with the WaveOne file has been shown to decrease the shaping time by about 40% when compared to a traditional rotary technique in continuous motion. The original WaveOne file is made out of M-wire nitine metal. This provides greater resistance to cyclic fatigue, which is the leading cause of file separation. Testing show it increased this resistance by over 130% over regular nitide rotary file instrumentation. The original WaveOne file system comes in 3 sizes: small, medium, and large. This works for the majority of cases. I would say I use the primary WaveOne file only for about 80% of my cases. And as an endodontist, I'm not seeing the simplest of cases. As I stated, the WaveOne file system has been my file of choice because of the modified reciprocation motion, the decreased chance of file breakage, and the shorter working time in the canal. And I am happy to report that I have not had a WaveOne file separating the canal system since I've been using them. That's approximately 3.5 years of treatment safety for my patients. So with all of those advantages, you may ask, why did I switch to WaveOne Gold? Because of the enhancements in the file and the file selection. Let's look at some of the enhancements that have been made. Number 1, the gold metal. The file is traditional nitine metal that is first machined during the grinding process and then heat treated to give it the gold color. This heating process gives the WaveOne Gold file increased flexibility and increased resistance to cyclic fatigue. In internal testing, they have been shown to have a 50% increase in resistance to cyclic fatigue compared to regular WaveOne and 105% over traditional nitide rotary files. Number 2, the file has a small amount of memory which will allow you to put a small curve into the file. This can help you maneuver the file into areas that are difficult to reach. For instance, up under the mesiofacial cusp of an upper molar. Instead of having to remove some of the cusp, we can make smaller accesses and thus preserve more dentin while still having enough visibility to do our root canal therapy. Small accesses mean stronger teeth that are less prone to fracture. Minimally invasive dentistry. Number 3, the file now is variably tapered, which means that it has a smaller maximum diameter of each file. This means less removal of dentin and thus more dentin preservation. Number 4, now there are 4 sizes in the WaveOne Gold family. This will help cover a wider range of canal anatomy. All tip sizes now correspond to ISO colored standards as well. The small file has a .07 taper and is .20 at the tip. The primary file has a .07 taper and is .25 at the tip. The medium file has a .06 taper and is .35 at the tip. The large file has a .05 taper and is .45 at the tip. The primary file is still designed to perform about 80% of the cases with just this one file. These tapers will still enlarge the apical area enough to remove debris in the apical area. It will also allow an irrigating needle to get within 2 millimeters of the apex for proper irrigation of the apical area. Number 5. WaveOne Gold files have a parallelogram cross-section and have 4 cutting blades now instead of the 3 which were found in the original WaveOne. This leads to greater cutting efficiency and increased space for debris removal. These alternating cutting points help minimize the screwing in effect. Internal testing showed the WaveOne Gold file was found to reduce instrumentation time by 19% compared to regular WaveOne files and by 60% compared to regular NiTi rotary files. Number 6. All files now have a non-cutting tip instead of a modified guiding tip. The similarities between the WaveOne Gold and the WaveOne are the 11 millimeter gold-plated brass access handle, and they still come in a 3-pack sterile blister pack. They also have the ABS ring, which will ensure single patient use. And the technique is the same as the regular WaveOne. So these are the many reasons that I have switched and made this my improved file of choice.